if there are any questions, we'd be happy to take any questions.
Can you talk about the severity of the flu that we've seen in these 27 cases? Mr. Baker touched on it a little bit. In Mexico, we know the strain was much more virulent. Here in the United States, we've seen milder cases. Is there any reason to believe that we have deadly swine flu here in Milwaukee?
Well, we do not have any deaths attributable to swine flu here in Milwaukee. But that is one of the questions that I've asked to have a better understanding of what the severity of the disease is. So I don't know if either of you know the severity of the case. Nationally, Dr. Swine can talk nationally.
John Swine, Milwaukee Health Department. So the CDC, excuse me, the CDC announced today that their surveillance is indicating a hospitalization rate nationally of about 8%. So roughly 8% of people who are getting this swine origin influenza are having to be hospitalized. So I don't have the information about the severity of the hospitalization, but of course these days, if someone has to be put in the hospital, you know it's at least moderately severe.
I think if I can follow up on that, to have a better understanding, when Dr. Swing relayed that information to me, my question, and this is the data that I want to get in the next 2 days, is what percentage do we have here in Milwaukee? If we're at a much lower percent, then that's going to tell me one thing. If we're at a much higher percent, it's going to tell me something else. If we're right there at the national average, it don't make sense. But that's part of what we are in the ongoing analysis of right now.
Have you guys been in contact with other departments around the county? Because these 27 cases are all in the city, correct? Are there...
We cannot say that with certainty. Again, what we can say is the 6 that we have talked about, the six of them are testing that has been done by the Milwaukee Health Department. 21 cases have been tested in cooperation with Children's Hospital. I cannot say with certainty that all 21 of those cases are City of Milwaukee residents. My strong belief is that a large proportion of those, or a large majority of those, perhaps all of them are, but I cannot say with certainty that all of those 21 are, because those are testing that came to Children's Hospital independent of the city.
Is there a reason to believe that it's being passed on in the schools? Why such a concentration on the south side that you touched on?
Well, maybe you want to touch on it. I think it's fair to say that of the 27 or the 21, that a large number of them are children, if not all of them. Certainly, most, if not all of them, are under the age of 18.
And have the majority of these people, have relatives in Mexico, have relatives that have come from Mexico, have they been to Mexico? Is that a concern at all?
This information that we're sharing is the result of the clinical analysis of specimens. What starts now is our epidemiological follow-up, our contact. We will be answering those types of questions through the weekend to look at travel history, to look at every contact that each one of these probable cases had, and we'll have more information to share. But as of this time, we know the disease is circulating here, but we will do the expert work of finding out who these probable cases came in contact and was their travel involved in their case.
And what if these cases be confirmed this weekend?
I'd like to just add on to what the Commissioner said. The important point on this is that this disease is here in this community now. So people don't need to think that their only risk is if they're traveling, because it's here now.
When will you expect to be confirming the probable cases from earlier this week, confirming or dismissing those cases?
Those are happening very, very quickly as we speak, is my understanding that there are analysts who are looking at that. So that's why when Dr. Swain said he thought the numbers would change, we expect those numbers to change over the next 24 to 48 hours, so because the testing is ongoing.
Let me add to that. What's happening nationally is that every public health laboratory in the nation is forwarding all probable cases onto the Centers of Disease Control, and they're making the final confirmation and updating the case count nationally. While we will have that part of our investigation done, these samplings will go on to the CDC for final confirmation or be added to the national case count. While we may know in 24 to 48 hours with reasonable reliability that those are likely to be confirmed, we don't know exactly when the CDC will update their count, but Wisconsin cases certainly will be in the fold and will be forwarded down, and those national statistics will change rather rapidly.
So in other words, is it just semantics then? You know if you've done rapid genetic testing that you've got H1N1, you know you can see that from the lab results, you just need the sample approval essentially?
It's not necessarily semantics, but the Children's Hospital Health System Laboratory has the capability on the ground that mirrors what the Centers for Disease Control has. The City of Milwaukee laboratory, by the end of the weekend and early next week, will have the same technology that the Centers for Disease Control has in Atlanta, and we will be able to mirror their confirmation, as will the Wisconsin State Lab of Hygiene in Madison. So you'll have a three-triad approach of laboratories here in our backyard that will have the ability to mirror the confirmations that the Centers for Disease Control are making, therefore providing that information and near real time from probable to confirm.
Commissioner, I want to ask, earlier today, Waukesha County Health Director advised on group gatherings over the weekend. Can you talk about that again specifically? If we have an increase, I know you talked about 6 feet away, but where does that stand in public activity or closed buildings? Do you want to talk a little bit more about that?
Well, our guidance all along is for individuals to manage themselves. If they're exhibiting symptoms that are consistent with influenza, that they would sequester themselves in home and then contact their medical provider. Our guidance right now in terms of large social gatherings has not moved to the area of recommendation that they either be curtailed or altogether stopped. We will revisit that hourly and daily as long as we're in the process of this investigation, and we'll be in close contact with the Centers for Disease Control if their guidance would change. The Centers for Disease Control has stated that each local community must manage and make that assessment. We in Milwaukee are making that assessment, but our number one advice now is for individuals to monitor their symptoms of illness and then to remove themselves from work, school, or large social gatherings.
And how will we update this over the weekend?
How many are hospitalized now and how many are at home?
I don't know that we know that yet.
We don't have that data. Once again, this information is coming to you in nearly real time. We have these assays. They've been put forth as probable cases, and now the follow-up on the status of those individuals. This data goes also to their medical provider who maybe took the sample. So they're getting the appropriate medical follow-up now, and decisions will be made on whether or not they need to be admitted given the severity of illness, whether they need to start prophylactic or treatment or any type with antiviral medication. Those things are happening as we speak, but this data is coming to you within the last several hours of leaving laboratory assay.
And on that point of antiviral medications, do you still feel you have an adequate supply if this were to balloon again? We've seen it jump over 10 times in one day. Do you feel like you have an adequate supply of people who need that medication getting?
Well, we're certainly pleased that yesterday the governor's declaration opened up access to assets here in Milwaukee on the ground. We do know that the state of Wisconsin has received antiviral medication to the Strategic National Stockpile, and we're in receipt of medication as well. There appears to be, with all certainty, enough medication now to mitigate situations that are happening here on the ground. And certainly we have an open access to the state of Wisconsin, and we're in constant communications with their stockpile. So I don't see and foresee any concerns at this time as this outbreak unfolds.
And just to be clear, as far as large gatherings, you're not going to recommend shutting down, say, a Brewers game or staying away from the museums or anything like that so far? No recommendation?
We have no recommendation to suspend or to tell large social gatherings at this time. Our advice is for social distancing in terms of individuals monitoring their own venturing out when they encounter someone who's exhibiting influenza-like illness or coughing or appear to be sick. We ask them to have that 6-week distance and take individual social distancing to heart.
Of those 27 cases, is it possible that any overlap with the ones identified in Waukesha County today? Or are they all 27 just from Milwaukee?
They do not overlap, and this is completely independent.